Hi, and welcome back, everyone. I'm your host, Mitch Simpkins, and this is Wins for Widows, where you get practical guidance from the mouth of professionals who are united together in helping you get your feet back on the ground after experiencing the loss of a loved one. Together, we'll uncover the rooted question that you might be asking yourself: what now? And what should I do next? Today, we have someone from the beautiful state of Tennessee. She comes to us from Nashville. It's my privilege to welcome her to the podcast. Aimee is the president and CEO of MCC Legal, and she bridges her role really is in this capacity is to bridge the gap between the medical, legal, and community worlds, offering specialized services in medical and general paralegal support as well as firm administration. Aimee has 27 years of experience and has the distinguished designation of a National Senior Certified Advanced Professional Paralegal. That's a mouthful. Acronym PP, where she helps families and individuals confidently navigate complex legal and medical care challenges, especially those who are facing transitions, loss, and vulnerability. So we're honored to welcome you, Aimee, to share your insights. I'm particularly excited. I mentioned this kind of in our prep, but I'm particularly excited to talk with you about your medical background, because there's a lot of the viewers who are in a space where they need advanced medical care potentially, or more than just living on their own in their homes. And I know you have a lot of experience in that space. I'm really excited to kind of dig into some of that space. What did I miss? Anything else about your background?
No, I think that we're starting off good, but thank
Okay.
you very much. I'm very proud and very glad and honored to be here. I appreciate the invitation and I'm looking forward to it. I think we're going to
Yeah.
have a lot of fun here in the next little bit.
We are. Thanks, Aimee.
Right.
So let's talk a little about that care coordination piece. So, what are some of the most important legal documents or steps that widows should be prepared for when managing care, like for a parent or for themselves, in a nursing home or an assisted living facility? What do you recommend there?
Definitely state administration would be number one, and ensuring that your loved one has appropriate and non-expired healthcare insurance and prescription discount programs in place to cover all the necessary expenses to reduce the liability of the copays and the pharmacy expenses. We often forget when sometimes families will, place a family member somewhere, or sometimes they don't have family, unfortunately, and they have to consider what are my best options for myself.
Yeah.
And when we do that, we expect for the caretakers to be able to take care of ourselves or our family member. And a lot of times we have to remember it's very, very important to advocate for our family member and make sure that these things are in place because they won't take care of that stuff for
Right.
them. And
Yeah.
then a period of time goes by where they're neglected to a certain extent.
Mm.
And then they realize, oh, these things need to be in place. So those are very, very, very essential. Those are number one.
Review those again, really quick, Aimee. What are they again?
Estate administration would be number one. And then
Okay.
also making sure that your loved one has non expired healthcare insurance and prescription discount programs. And here's why. A lot of times they, at these, there, I mean, this world, I'm sure your broadcast goes out to a pretty good area, but a lot of these folks have zero income. And even if they're getting Social Security benefits or if they're getting other types of other governmental benefits, that doesn't, there's no one there to really help them update their insurance if they have to reapply or
Mm.
renew,
Oh,
or
interesting.
sometimes they'll have insurance, but it doesn't cover some of their prescriptions. So you can apply for those prescription discount programs. And that really helps to keep some of their Social Security checks in their pockets,
I see.
helps to keep their SNAP benefits, helps to keep their cash benefits that they might receive instead of spending that on these very expensive medications. And sometimes that happens where they find themselves in polypharmacy, which is where they have multiple prescriptions.
Mm.
And it's, one starts off as you need this, but then you need this to counteract or the constipation. And then to counteract that medication, you need this. And so
Mm. Mm.
Polypharmacy, the word poly just means multiple.
Okay.
So then that's created, and that can become very, very expensive on a monthly basis, and sometimes will eat into every bit of their Social Security
Interesting.
income.
Okay, and so you're speaking that from a sense of, like, being able to continue receiving care in the facility that they're in. You wanna make sure that there's enough money to basically pay for that. Is that why you recommend those pieces right off?
The overall goal is just to look at what is the care package for the patient,
Okay,
and how can you extend out those benefits and minimize the costs?
I see.
That's
Okay,
the most
okay,
important thing,
very cool.
because then at some point, that family member starts to feel like a burden to the rest of the family.
Okay.
And if you can help, navigate this system for them, they feel less of a burden, because then they feel like, oh, I still got some money in my pocket. I'm not having to do this and that. And it becomes like this center focus on their emotional well-being, and their mental health.
Interesting.
And you can do that by advocating for them in lots of ways. Another very important part, so the estate administration would be ensuring that they also have a healthcare power of attorney, a living will, a last will and testament, just a general power of attorney, so that way your family members can sign on those documents to say, I'm her representative, I'm his representative. I need to be able to take care of these things, especially if they're a veteran. We see the majority of our baby boomers are, they're they're either a veteran or they're a veteran's spouse, and they still receive those benefits. So if we can take a look at those benefits and constantly keep in touch with the VA to say, hey,
Mm,
what
mm,
benefits are available that we're not
mm.
utilizing?
That's great.
Um, and then what trumps all of this, though, is rolling all of your estate administration into a family trust account. Now, being I am a national senior certified professional paralegal, I'm not an attorney, so I have to be very, very careful in this podcast that I can't give any kind of legal advice. But I can inform the general public of resources that are available and how to tap into those resources, especially in a time where you become a widow. A lot of times, these widows are dependent on their spouses. Spouses have been taking care of them financially for a long time.
Yeah.
This becomes a very difficult place where it's really scary. You don't know what to do, but there's a lot of great resources out there to say, hey, find yourself in this place, trying to find someone that can help you navigate. And here's the most interesting part of it. And this is one of the biggest things I took away from nursing school. When you're going through something tragic, your brain can't process important steps to take.
Mm,
In other words, when somebody's grieving, oftentimes family members will step up and say, I'll take care of the funeral arrangements. Don't worry about that. I've got it.
mm,
Because your
mm.
brain's not focused on that. Your brain is focused on grieving.
They call it
It's
fog brain. I think fog brain is the word I
That's
hear
right. And
often
you
in my
can't,
understanding.
it's hard to think about, how am I going to take care of myself financially
Yeah,
now? Because you're
yeah,
just in this dark pit that's
yeah,
very hard to climb
yeah,
out of.
very hard, very hard. Very hard. So having help around to be able to do that. I love that you focus on the benefit piece of it. I love that you're focusing on helping them stretch the dollar to make
Mhm.
to continue to allow that care. And I know one of the things, and you kind of alluded to this, but one of the things we talked about was state-specific legal restrictions and the impact on everyone to receive resources, legal resources. Tell us a little more about that for people who maybe can't afford or don't have access to the traditional law firms that are very expensive. Where do they go? How do they get to those? And how they access some of those services that are so necessary that you mentioned?
This is such a great question. And this is really a field where I'm most passionate at.
Mm,
This right here. That's the golden ticket question. So often sometimes we'll see, let's say for example, this unfortunate widow is in a place where he or she may need an attorney. So they go consult with the attorney, and the attorney requires a very large retainer fee, which this person does not have.
yeah.
And so this person can't afford legal representation, so they'll try to seek free legal aid from either the Legal Aid Society or some other kind of resource. However, they're required to serve priority cases at the Legal Aid Society, which
Mm,
is a great resource to have, but they serve the priority cases related to safety and health risks.
mm,
So if you come in and say, "Hey,
For
I just
something
need some
different.
estate documentation," you're
Okay.
gonna fall far below than the wife who's being battered and needs an order of protection.
Interesting. Or is being abused in a facility and has to make a
That's right.
claim. Okay. They
That's
get it.
right.
They get a higher priority than someone who just wants
It's
an estate.
based on a higher priority list,
Mm,
and at the same time, it's also based on an income range.
okay.
So, for example, let's say this new widow, who's unfortunate in her circumstances, she's not at poverty or below. She's also not wealthy. She's kind of
Mm,
stuck in an area like,
middle.
I'm about to go broke. I'm about
Yeah.
to lose everything that I've ever had in my life,
Yeah.
and I don't know what to do with it. And so what the Legal Aid Society will do is they'll place them on a list and then they feel hope. So I'm going to get hope, but then that waiting list never really comes around to them.
Mm,
So
mm,
what do you do then? So a lot of times go to the court's website or they'll call the court clerk's office and say, "Can I just file my own legal documents?" And they'll say,
mm.
"Well, yeah, I hear you. Here you go. Here's the website. Here's the links. Here's the documents. Print them out, fill them out, bring them back up here." But then what happens in a lot of counties, a lot of these courtrooms will say, "I'm sorry, this isn't filled out correctly. You're going to have to hire an attorney." So then it becomes
Yeah.
this circle of, I'm not getting anywhere and I can't get the right kind of
Yeah.
help.
Yeah.
And so what I'm trying to do, this is where my passion steps in. I'm really trying to advocate and become an ambassador. So what I'm considered and what many professional paralegals are considered are non-lawyers.
Interesting.
And currently, the American Bar Association
Huh.
only permits non-lawyers to work in certain permitted states to do general work for the public.
Hmm.
So what I'm trying to do is I am an ambassador for the state of Tennessee, and I'm trying to become an ambassador for other states as well, to be able to say, we know how to do the
Allow that.
work.
Yeah.
We need to be able to step in and say, these people are being ignored. Either the proverb, you are able to get some free work done if they are on that priority list or whatever.
Right.
But there's this gray area that
Right.
exists in the United States
That doesn't
where
get the
people can't get
service.
that help.
Interesting.
So we're trying to be able to do that.
And you would actually do it. Paralegals would then do the documentation and be able to build the interesting. Okay. At a much lower cost than what it would be to go to a traditional law firm, to an attorney.
Right. And right now, as it exists, I can perform those services, but I have to have an attorney supervise and oversee my
I
work.
see.
So it all has to be approved and under the work of an attorney. But I'm
Which
trying,
increases the cost, right? Which increases the cost because they're
it
not gonna do it for
increases the
free. They're
cost.
not gonna be like, "Oh, yeah, for sure. Interesting."
Right.
That's cool. No, that's great because that's a big piece of people's estate, and they can be complex. They can also be super simple,
Hmm.
right? They don't have to be terribly complex, and
They
with
don't.
with someone that, based on their financial situation, if it's not extensive, there's probably not a lot of complex things about it, and it can be a very simple will and trust. So will, trust, even trust or no trust. You probably can't advise on that, right?
I can't
You
advise on
can.
it, but what I can say is that one would have to speak to a CPA or an attorney to find out the benefits of
Of
rolling
having a
all of your
trust.
estate administration into a trust,
Yep.
because then there's
Yep.
some significant belief
Trusts
there.
aren't always necessary. I get that question all the time. Do I have to have a trust? No, you don't have to have any of this. The question is, what's the advantage of having a trust? And if you do have a trust, then what benefits, what things do you avoid as a result of, and is it even necessary? I'm no
Mhm,
attorney either, but I've seen in some circumstances they've gone to attorneys and the attorney says you don't need a trust.
mhm.
A will is fine. Legal medical powers of attorney and advance directives, you're great.
I will tell you this, in the state of Tennessee, and I assume that this might be the same case in a lot of other states as well, but I know that here in particular, if you roll all of your estate administration into your trust and let's say you pass away, if your documentation is not in a trust, as I understand, your family would have to go to probate court and fight over it. And so attorney's fees would have
Interesting.
to be paid.
Yes,
If
yes,
it's in a trust, no
yes.
fighting or anything like that. It's because you've already went through an attorney and it's there waiting and available.
Yes.
don't have to go through
Yes, and
probate.
I know there's certain, like, limitations about the type of asset that it is and the dollar amount, and again, we'll let the attorneys, piece that out, but something to be aware of, something to ask questions about. There are some
Yes.
stipulations. No, thank you.
Definitely do your research,
That's
100%.
awesome. So,
Yeah.
Aimee, you mentioned something, kind of alluded to it. I wanna focus on it for a second because I interviewed, on podcast a little bit ago was another attorney, I can't remember the exact state she was out of, but I said, "What's your biggest case that you deal with?" And, actually, it was a gentleman, and he said abuse, elder care abuse in care management settings.
Ugh.
I said, "You're kidding me." And I've heard other people say, like, "It's so hard to find the right care for my person." So, based on your experience, what's the biggest risk that widows or elderly women have being taken advantage of in a care setting? And what practical steps can families or them take on their own to protect against any financial or legal or other abuse that might be going on out there?
And this is very important. And if you really take a step back and kind of assess like why is this so prevalent in the United States right now? It's because like I stated earlier, the majority of our baby boomers right now are either already in some type of assisted living facility or nursing home
Yeah.
or end of life care. And so we have, and this is a statistic, we have more people in the need of care than we do have a nursing staff to take care of them.
Mhm,
So if you think about a classroom setting with
mhm,
children, right,
mhm.
to the teacher, you look at a classroom that has 22 children and
Yeah,
one teacher,
it's
they're
rough.
not getting any one-on-one
Interesting.
direct education.
And that's
So
the case with care in facilities. Interesting.
yeah, and so they're at these facilities, they're not getting the care that they need. So a lot of times, what does that mean? That means they're having skin breakdowns. And
Mm,
so they're having a lot of these infections that aren't being oversought because somebody comes in and unfortunately they've got 3 minutes to get them up and get them ready and get them
mhm,
somewhat, available for a shower. And then that next person comes in, they've got 6 minutes to get them in the shower and out. And then the next person comes in. So it's like this system, it's very coordinated, but it's all based on how many patients are there available in the facility at this
mm,
time that we need to take care of.
mm,
My background, I did 5 years in assisted living facilities, nursing homes, and then dementia
mm, mm,
departments.
mm.
So, a lot of that, it kind of graduates in as far as, like, the care required, those levels elevate and they
Right.
become bigger, then the need becomes bigger. But so working 5 years in those facilities, I witnessed time and time again complaints being made about the staff shortage and its resulting noncompliance in general care as well as financial fraud.
Mm,
So what we good takeaway about
mm.
this is just to say it is absolutely essential to check in on your family member and visit them often to ensure adequate skincare. And don't
Right,
just
right,
assume that they're being taken care of.
right.
Take a look at them and look at their arms, see if there's any bruises or if it looks like they're dehydrated, then there would be some pitting, something like that. Make sure that they're getting medication compliance and that polypharmacy is not there. So take a look at their medication and say, well, what is my mom taking? And then,
Mm.
take a look at that and say, how can we reduce this? Because she's talking about, these issues of being constipated for too much.
Those are great, pieces of advice and definitely relevant. So you kind of alluded to advocacy, getting
Mhm.
involved, being an
Yes.
advocate. So to improve and continue to keep the quality of life and peace of mind for widows entering long-term care. What
Mhm.
other advice do you have for families around that? Preparing someone to go into a facility, that's a hard transition, and especially if they
Yes.
really don't wanna be there, it's very emotional for everyone involved. You almost feel like you're giving up on your parent that born you and that, took care of your whole life. What do you
Well,
suggest
and
there? What have you seen?
I think it is an incredibly hard decision to make because you take a look at what you can do for your family member, and sometimes these family members say, "I want the best care for my mom and dad, or for my aunt, or for my friend, my neighbor."
Yeah.
and I'm just not able to provide that. It's not because I don't want to, it's
Mm.
that they deserve better skincare. They deserve better medication compliance, and it's a full-time job. It
Yeah.
really is. And then if you take a look from the widow's perspective, she needs somebody to completely be able to take care of her holistically, so emotionally, mentally, physically, or him. And the next best step that you can do also is just make sure to go to every single doctor appointment with
Mm,
this family member,
mm,
be their legal representative, their healthcare advocate.
mm,
And
mm,
here's the darkest part about it, Mitch. They are often so scared, and they don't know how sometimes, especially if they're entering into dementia, how to make good decisions for themselves
mm, mm,
anymore. And it might just be a little here and there, but they know it and they can sense it and they can feel it. And
mm,
then sometimes they're like, I don't want to say anything about it because then I know my family's not probably going to be able to take care of me. And
mm,
then we start looking at those facilities, and
mm,
then sometimes they're left in a situation where they don't have family, and so they go into these facilities and they don't have anyone visiting. So here's something I always love to say. When we had people coming in, sometimes we would have these open invitations, open houses. Come be a mentor, adopt a family member, right?
That's cool. That's very cool.
Sometimes
That's very cool.
sometimes these people,
I
and
love that. That's so fun.
it's a beautiful thing to
It's
watch
amazing.
someone come in and just say, "Who can I sit with today?" and play bingo or play some kind of a board game or something like that, or even sit down and just
Mhm.
like knit with them or, do some kind of a cool little activity. Sometimes just being there and listening because they have so much to say. And when somebody comes along and says, Tell me about your life history, it is the most beautiful thing. Sometimes they are
That's good.
heroes. Sometimes they've changed the world somehow. And sometimes you hear about these, oh, I played professional baseball. What?
Wow.
You did? And tell me about that. So it
That's
becomes like
cool.
this, it's a beautiful moment, but,
That's
you know,
cool. That's cool.
not everybody has a family member. Not everybody had children, and not everybody had grandchildren. So
Yeah.
when they're in these facilities, they really need somebody to come by just to listen because
Yeah.
nurses don't always have the time to listen. They
No.
want to,
Yeah.
but they have to keep moving.
Nurses have big hearts.
Yes,
They just don't have big time sometimes
that's
or the
right.
ability to do that. And so I gotta say this, I gotta do a shout out to my sister-in-law. So, I'm gonna try not to cry, Amy, because she's only been gone very long. My mother-in-law died about a month ago,
Oh,
and so my sister-in-law jumped in. She's one of my wife is, the youngest of 7 girls. So
wow.
my mother-in-law went from house to house for a long, long time. It wore her out. By the time she was 94 or something, actually, was it? Yeah, so she died at 97. So at 95, my sister-in-law agreed to take her into her house and take care of her until she passed away a
Oh,
month ago. What
she's
a
a hero.
blessing for her. I know everyone doesn't get that same privilege, but
Oh,
what a blessing for her to have someone there that just took good care of her and had people around her, and she died very peacefully towards the end of her life. But it's having watched that and seen like what it really meant for her to just have someone there that really took great care of her,
yes.
like, and to then see the honor and the what's the right word? I don't wanna say prestige, but the feeling that gave her of importance and
Mhm.
recognition and honor, I guess, is the best word towards the end of her life.
I'm
It's critical. It's so critical, and it's so important, and I get it. The system, it's hard to have that same type of care in a large system where there's multiple people in the same.
It is, and that truly is a blessing, Mitch, and it's such a beautiful story to hear. I commend your sister-in-law for doing
She's
that.
amazing. She
My
got
mother
lots of kudos at the funeral, and she's amazing anyway, but a real gift.
my mother, when she entered dementia, we brought her in and helped to take care of her for 3 years, and then now my sister is helping to take care of her. And, so everybody kinda knew, Amy's done all of this, for the last so and so years, so she's the most appropriate
Yeah,
person to take care of her, and
yeah,
and so
yeah.
I did, and
Did you
and,
really? Good for you.
but here's the thing too is that when people think about bringing in someone and taking care of them, it's not always rose colored glasses.
Yeah.
It's not beautiful. It's not always perfect family.
No.
Sometimes it can be very dark, especially because dementia patients are known to have sundowning. And
Right.
sundowning, a
Yeah.
lot of people know, is when somebody can really start to feel frustrated. All of their anxiety sets in, all of their depression sets in, those end of life, thoughts. And
Mm,
so then they can become very dark and it can be hard to control. But
mm,
so here's something I wanted to mention too: support groups. Support groups for the person who's needing care and support groups for the person who's giving care, because
mm,
there's also this thing, it's called the invisible patient. So
mm,
the invisible patient is often, so you've got daughter or son that's trying to take care of mother and mother and father is needing all this health care, but then father or this daughter or son is trying to work and trying to provide care, trying
mm,
to pay the bills and still trying to take care of this person,
mm.
trying to assess what all is everybody's needs. What happens is
Rough.
this person, the caretaker, the family member, starts to exhibit these health complications
Yep.
and starts to have heart issues and starts to have,
Mm,
all this obesity is becoming very prevalent in this. So
interesting. Interesting.
so we have to kind of take a look at this and remind ourselves
Yeah.
not everything is perfect, not everything is beautiful. And what
Yep.
we really need to do is encourage everybody to continue good mental health practice. And that could be support groups, which are amazing. And
That's
those
right.
often are free. You can find those in your any given community. And so that's always a really good thing to suggest. And there's also a lot of nonprofit organizations who will step in and kind of do these ones as
Love
well.
that. Love that. It
Yes.
was a lot for my sister-in-law. It was no easy task. It was a full-time gig, and luckily she could do it. But yeah, I could see that eventually it could wear her out. It was very difficult. So yeah, but what a blessing. Great advice. My gosh, Amy. I didn't know I was going to talk about my mother-in-law today, but we miss her.
I'm
We
sure she
miss
was.
her, and kudos to Debbie. So yeah,
What blessings.
she's awesome. Yep, she's
It's
awesome.
amazing to have family and to as the human race, just to see the beauty that can be possessed among each other.
For sure, or to extend that family by other people, like you said, that are willing to come and serve and give and become
Yes.
that family. I love that. Amy, what did I miss? Anything else that we need to make sure that we hit on? And then you can sing. We got just the last thing, and then the song to finish it off, and we'll close it out. What do you think?
Well, let's talk about for a moment the resources that are available out there for any given community.
Good.
So let's talk about that for a moment.
Okay.
Resources, especially right now, there's a government shutdown. So anybody who might be a veteran or be a spouse might not be receiving any kind of benefits right now.
That's
So
right.
if you are
Right.
someone who is going through this experience and you're kind of going in it, or you're already in the middle of it and you don't know what your resources are, 100% call your local chamber of commerce.
Mm,
Every single city, every single county is set up to have the chamber of commerce. And
mm,
essentially, what their function is to connect you with your local resources.
really?
You can
Okay.
also call 211. 211 is also a fantastic source and it'll connect you with the exact same resources. So, what they'll do is they'll provide you a list in your given community and possibly the next community as well, if it's a neighboring city. Sometimes they do sister work like that,
Mm,
and they also connect you with referral provider services. And some of the services that they may refer someone to is your local Meals on Wheels. And when people hear that, they think
yeah.
free meals. Well, they go above and beyond that. I know that my mother worked for a Meals on Wheels program in Bradley County, Tennessee for over 20 something years because she
Very
fell
cool.
in love with what they were doing and
So
she
cool.
believed in this program.
Mhm.
And so what they do is they will provide free or reduced assistance with utility bills, which can save your family member a significant amount of money.
Oh, okay.
And
I know
they
that.
get free meals delivered to them every single day. So breakfast, lunch, and dinner.
Very cool.
And especially if they're on a fixed income, they can definitely qualify for that.
Didn't realize that. I thought it was all food. Thank you for enlightening us.
You're welcome. Another one is I know that they're not approving SNAP benefits right now. but you can always at any point take a look at your healthcare insurance options.
Mm.
Your healthcare insurance can always be modified along with your pharmacy prescription plans.
Mm.
Apply for those SNAP benefits. You never know if you're going to be, and don't be ashamed to reach out, because here's the thing: all of these governmental programs are set up to give, they receive a certain amount, a certain budget.
I see.
And if the community is not utilizing
Uh,
those funds, the government takes them
lose it.
away and puts them into a different program.
Interesting.
So don't be ashamed. You can apply for these benefits and keep them to yourself, and nobody would really know, but it really helps. And then also for those who have pets, sometimes they're going into an assisted living facility or a nursing home and they have a dog or a cat or two,
Mm. Mm.
and they don't know what to do with these. Sometimes you can reach out and they can help you rehome them. But if you take them with you, the local chamber of commerce can also set you up with local resources to aid with pet services.
Really?
So they can help you do pet grooming, and they can help you buy the materials that you might need. Local churches, the Salvation Army, food banks, local greenhouse ministries, these are a great place to find food boxes, bedding, winter coats, emergency assistance to get them through hard times. Sometimes these people aren't just going into a living facility, they're living in their home that they've had for 30 something years, and that home is falling apart.
Mm.
So these places are a good resource to contact and say, my crawl space, there's something crawling up under there all the time. Um, is there someone that can come out, and they will find a volunteer to come out and fix these things for you on your
Very
home
cool.
if you're on a budget.
Very cool.
And then another one, nobody really thinks about this, but so I graduated from Middle Tennessee State University here in Tennessee, and the universities are another fantastic resource. If you contact your local nursing dean, a lot of times they will connect you with volunteers who are begging
Mm.
the general public, please give me volunteer opportunities, because they get school credits,
Uh,
class credits for
very
these,
cool.
especially if they're in nursing school.
There you go.
And so what they'll do is come out to your house, they'll check your vitals, they'll make sure that your medication is spread out in your pill box. They'll make sure that they'll do some light cleaning, like your dishes, take out your trash, and make sure that your electrical outlets and stuff like that are safe. There's no fire risk or anything like that. And this is a very valuable resource that not a lot of the communities know about. And they'll just come in, and it's good to sit. If you can't be there because you're working, but you need somebody to watch over your mother
Yeah.
or your father, they'll come in and they'll sit and they can just play games. They're free to you, and they get the credit. So it's a mutual beneficial
So, Aimee,
relationship.
you're giving me some really good ideas. My youngest child is going to be leaving my home next year. He mows my lawn. I'm just saying, how broad does it have to be nurse related? Does it have to be medical? Will they come help me with my lawn, Aimee?
I don't know about that. I don't know what state you even live in, Mitch, but
You're
you
probably
can always
saying,
try.
well, I'm going to try it. There's a lot of universities around me. I'm going to call the nursing director today and say, hey, next year, I don't need it this year, but next year, can you come and help me with that?
Right, good.
I'm going to tell my wife I found a solution. My son's going to ask for it now, but we'll wait for a year. Aimee, great advice. So fun to have you. I love that that hospitality that you have. Just that, I feel like I'm in your front room learning from you and talking to you. It has been an absolute pleasure. I appreciate you taking time to be on here, and you've got such a broad breadth of knowledge. So fun. And I love that we focused today on that medical piece that I haven't had yet. And so I appreciate you bringing that in with the legal. You're not only just a pretty face, you're an incredible mind and lots of knowledge. So thank you so much, Aimee, for being with
Thank
us.
you. I just want to give a shout out to MCC Legal. We are here. Our mission is twofold: provide affordable virtual legal services to the general public, serving as a friendly and approachable legal advocate. And of course, that's notated that the ABA, there are some current limits as far as non-lawyer services to select U.S. states. And then we also offer streamlined, comprehensive virtual medical paralegal, general paralegal, and administrator services to national law firms and solo practitioners, reducing overhead, enhancing your efficiency, promoting productivity, and substantially increasing your gross revenue. Apart from that, MCC Legal also encourages its communities to give back through local roundup and participation in charitable and community organizations. And MCC we love to say we are bridging the gap between medical, legal, and community, and we have a passion to continue to do that. So please contact us through, you can visit our website at mcclegal.support. You can also find us on LinkedIn and Facebook as well as Instagram. Please contact us. Our email is contact@mcclegal.support. And I just thank you so much for your time today, Mitch. It
Aimee,
was an
thanks for
absolute
bringing it
pleasure.
all together. You brought it all
Yes.
together. You brought it today. So thank you so much.
Thank you so much, Mitch.